Welcome back to ShareTreck, everyone. I'm Jack. And with me today is Dianne. She's our biotech expert. We're taking a deep dive today into the type 1 diabetes gene therapy landscape, specifically from an investor's perspective.
It's such a fascinating area. We've all heard that 5 years to a cure line for what feels like forever, but what does the research actually look like today? And where should we as investors be focusing our attention right now?
Exactly. So let's jump right in with a name that I think a lot of investors are going to recognize, CRISPR Therapeutics, and their CTX211 program, which is also known as CTX211 now. I know a lot of us are watching this one really closely. So what's your take on their progress?
Well, they've definitely made some encouraging strides, especially with that trial happening at the University of Alberta. They're using this really interesting removable device to protect the gene-edited cells, which is a pretty clever way to boost the therapy's effectiveness, I think.
Oh, absolutely. There's definitely innovation happening there. But here's the thing. We can't just get tunnel vision on one company.
Yeah. No, you're absolutely right. There are actually 7 other major type 1 diabetes initiatives happening globally, totaling something like 634 clinical trials just in 2024.
Wow, 634. That's incredible.
Yeah, and that's really the key point. The cure is unlikely to come from a single magic bullet. It's going to come from the combined efforts of all these different approaches.
So diversification is key.
Exactly. Don't put all your eggs in one basket. Spread your bets, explore different companies, and really understand what makes each approach unique. So to kind of illustrate that, let's take a look at some of these different initiatives. We'll start with something completely different from gene editing, the OPERA study in the UAE. So instead of actually modifying genes, they're using this blood filtering technique. It's called extracorporeal photopheresis.
Hold on, blood filtering. So they're like directly manipulating the immune system?
Exactly. They take the patient's blood, they separate out the white blood cells, treat them with a specific drug, and then reinfuse them back into the patient. It's all about controlling that immune system attack on the insulin-producing cells in the pancreas.
Wow, that's fascinating. So it seems like there are multiple roads to the same destination.
Right.
Stopping that autoimmune attack.
Precisely. And another really intriguing road is the pulpeptol DC immunotherapy trial. It's happening at City of Hope. They're working with patients aged 18 to 45 who have been recently diagnosed, and they take their immune cells and basically train them to stop attacking those insulin-producing beta cells.
So it's like retraining the immune system.
Exactly.
So we've got gene editing, blood filtering, now immune system retraining. What else is out there?
Well, there's a trial happening in China that's using umbilical cord blood, specifically the regulatory T cells within it, and they're combining that with GLP-1 drugs, which are already used to manage blood sugar in type 2 diabetes.
Oh, so they're repurposing existing diabetes medications.
Yeah, it's a pretty clever approach. The idea is that this combination can modify the immune system's response and hopefully protect those precious beta cells. Now, this next one might surprise you. The Faustman lab in Massachusetts is actually investigating the use of the BCG vaccine, the one typically used for tuberculosis, to potentially rebalance the immune system and even regenerate beta cells in people with type 1 diabetes.
With tuberculosis vaccine?
Yeah, it might sound a little counterintuitive, but researchers believe that the BCG vaccine can trigger a specific immune response that could be really beneficial in the fight against type 1 diabetes.
Okay, I'm starting to see just how much diversity there is in this field.
Absolutely. And it goes even further. We have a company called Throne Biotechnologies with their stem cell educator therapy. And they're using umbilical cord-derived stem cells to, you guessed it, educate the immune system.
So more immune system manipulation, but this time with stem cells.
Yeah.
What's the status of this therapy?
Well, they actually received FDA approval for regenerative medicine advanced therapy earlier this year, and they're currently running trials in multiple countries, including the US, China, and Spain. And their research indicates that this therapy can actually improve metabolic control and even regenerate those crucial beta cells, even in people who've had type 1 diabetes for many years.
Wow, FDA approval. That's a big deal. That really speaks volumes about the potential of this approach.
It really does. And it really highlights the need for investors to keep a close eye on those regulatory developments, because they can be really strong indicators of a therapy's progress and viability.
Absolutely. This is all incredibly promising. But I think it's important to kind of ground ourselves in the reality of the situation. We were talking earlier about the growing number of people with diabetes.
Right, it's a global epidemic, and projections show a significant increase in cases in the coming years, which means the urgency for a cure is only increasing.
And that brings us right back to our investor perspective. What's the key takeaway here?
The type 1 diabetes gene therapy landscape is vast and incredibly diverse. Don't limit yourself to just one company or one approach. Diversify your portfolio, explore different companies and methodologies, and stay informed about the progress being made.
So spread those bets, do your research, and keep your finger on the pulse of type 1 diabetes research. Solid advice. But with so many trials happening, how do we even begin to evaluate? Which ones have the most potential?
Well, that's where things get really interesting. It's about looking beyond the hype and really understanding the underlying science. For example, Vertex, a company with a strong track record in cystic fibrosis treatments, is running international trials for their VX264 therapy.
Ah, VX264. I've been hearing whispers about this one. It's an implanted device, right?
You got it. VX264 involves implanting a device that protects those islet cells, the insulin-producing ones, from immune attack. And what's particularly noteworthy is that this approach eliminates the need for immunosuppressants, which, as we know, can have some pretty significant side effects.
Okay, that's a potential game changer. Avoiding immunosuppressants would be a huge win for patients.
Absolutely. And because of that, VX264 is generating a lot of buzz in the type 1 diabetes community. It has the potential to really revolutionize how we manage and potentially even cure this disease.
So another one to add to the watch list. Any other trials that stand out in terms of potential impact?
Definitely. Akademiska sjukhuset. It's a university hospital in Sweden. They're doing some really cutting-edge work with gene editing and cell transplantation. They're genetically modifying donor cells to avoid immune rejection, and then transplanting these cells into the forearm muscles.
Genetically modifying donor cells. It sounds like science fiction.
I know, right? But it's a testament to how far we've come in the field of biotechnology. By modifying the donor cells, they eliminate the need for immunosuppressants, just like with VX264.
So we're seeing multiple approaches converging on the same goal, protecting those precious insulin-producing cells. It's like a multi-pronged attack on type 1 diabetes.
Exactly. And that's why it's so important for investors to understand the different strategies being employed. There's no one-size-fits-all solution here. The cure, or perhaps more accurately, the effective long-term management of type 1 diabetes will likely involve a combination of these different approaches.
Diane, this has been incredibly insightful. I feel like I've gone from type 1 diabetes investment novice to informed enthusiast in the space of a few minutes. But for our listeners who are now eager to dive into this world, what's the key takeaway? What should they be looking for as they research potential investments in type 1 diabetes gene therapy?
The most important thing is to stay informed. Follow the progress of these trials. Understand the science behind the different approaches, and don't be afraid to diversify your portfolio.
Diversification, due diligence,
Yeah.
and a healthy dose of optimism. Sounds like a winning formula.
It's all about managing expectations while staying excited about the potential for breakthroughs. And remember, breakthroughs often come from unexpected places, so keep an open mind.
Well said, Diane. Now, before we wrap up this deep dive, I want to throw a question out to our listeners. Of all the approaches we've discussed today, which one do you find most promising and why? Let us know in the comments below. We love hearing your thoughts.
Yes, absolutely. We're all in this together, searching for a cure for type 1 diabetes. Your insights and perspectives are valuable.
And while you're at it, don't forget to like this video and subscribe to ShareTreck for more deep dives into the world of biotech and beyond. We're here to help you navigate the complex world of scientific advancements and investment opportunities. Thanks for joining us on this journey.
Until next time, stay curious, stay informed, and stay invested in the future of health. And you know what's really important here for investors? It's not just about the scientific innovation, it's about how these companies communicate with investors. For example, CRISPR Therapeutics, they're doing interesting work, but they could definitely be more transparent with their progress and updates.
Yeah, that's a good point. Clear communication really does build trust
And
confidence, which are essential for attracting investors.
absolutely. Now let's switch gears a little bit and talk about another company that's generating a lot of excitement. Vertex Pharmaceuticals. They're developing VX264, which is an implanted device that shields those insulin-producing islet cells from the immune system.
Yes, VX264. I've been hearing so much about this one. What's so special about their approach?
Well, what's really fascinating about it is that it eliminates the need for immunosuppressants, which are often needed with other cell therapies. But they come with a whole host of side effects.
So it's a potentially much safer option for patients.
Exactly. And that's why VX-264 is considered a potential game changer in the field. It could really revolutionize how we manage and potentially even cure type 1 diabetes.
Okay, definitely one to watch closely then. Are there any other companies out there pushing the boundaries like Vertex?
Yeah, there's a team at Akademiska sjukhuset in Sweden. They're doing some really cutting-edge work. With gene editing and transplantation, they're actually modifying donor cells at the genetic level to make them invisible to the recipient's immune system. And then they transplant these cells into the forearm muscles.
So they're basically creating stealth cells that can slip past the body's defenses.
Precisely. And again, this approach eliminates the need for those risky immunosuppressants. It's a real testament to how far we've come in the field of biotechnology.
It's amazing to see how many different avenues researchers are exploring to tackle type 1 diabetes.
It really is. And as investors, it's crucial to understand this diversity. There's no single right answer when it comes to investing in type 1 diabetes gene therapy.
So what's the bottom line for investors then? What should they be thinking about as they explore this space?
I think the key takeaway is this. The type 1 diabetes gene therapy landscape is dynamic and full of potential. Diversify your portfolio, do your due diligence on the science and the companies, and stay informed about the latest developments. This is a field where breakthroughs can happen quickly, and being prepared is essential.
Well said, Diane. I think we've covered a lot of ground today, and hopefully our listeners are feeling more informed and excited about the future of type 1 diabetes gene therapy.
Absolutely. And remember, we're all in this together.
Now, before we go, I'd love to hear from you guys, our listeners. Of all the approaches we talked about today, which one do you find most promising and why? Let us know down in those comments. We always appreciate your insights and perspectives. And hey, while you're down there, don't forget to hit that like button and subscribe to ShareTreck for more deep dives into biotech and so much more.
We're here to help you navigate this complex world. It's changing so fast.
Thanks for joining us today. Until next time, stay curious and stay informed. Happy investing, everyone.